Minutes of the last meeting, Evelyn and Bill, any changes? All in favor?
Aye.
Opposed? Carried. Okay, on, item number 3.1, I'll waive the report on the tracking of salary implications, go directly to B. Request to amend resolution number 264 of 2015, waiving section 1B3 of the Warren County travel policy relating to the GSA rate for the Warren County personnel officer to attend the 2015 annual civil service training, just changing the dates from June 8/10 to June 7/10. Bill, seconded by Evelyn. Any questions? All in favor?
Aye.
Opposed? Carried. Referral from Public Health Services Committee. Public Health is request to amend the table of organization and salary schedule to delete 2 nurse technician positions and to create and fill the new position of registered professional nurse, grade 19, annual base salary of $42,719 with actual salary to be determined, dependent upon nursing experience. You want to say anything?
The nurse technician positions that we're deleting are, the people are both retired. And so what that will do is it will be one less person in the department, and it'll save, a total of $11,000 plus a full benefit package. And the scope of the nurse technician, practice is different, so they can't do as much as the RN position, so it makes sense that this would be a good time to do that.
Okay. Moved by Sokol, seconded by Vanzelo. Yes.
Just a question, Mr. Chairman. As well as this department has done in the past and continues to do so, do we really need to bring these items to the table?
Well, that's what we keep saying, and pretty soon we won't have any items coming to the table.
It's good stuff. They're doing great over there.
I agree. All right, we have a motion and a second. Any questions? All in favor?
Aye.
Opposed? Carried. Moving on to Westmount. We got 4 different positions here with increases in salary. Request to amend the table of organization and salary schedule is indicated below to reflect the salary adjustment for the following positions effective January 21st, 2015. Lloyd, you want to tell us what's going on here?
A couple of quick items. The MTS coordinator and the staffing and service people, we've had some major changes over there, as you obviously know. Director of nursing resigned, and we've replaced her with Allie Gallo, who was the education coordinator. So she's starting as of Friday this week as a new director of nursing. We have 1 nurse manager who's been there about a year and a half, and we have 1 nurse manager position that's been open for at least 4 months, and we've been paying basically agency to cover that position. What we're finding is our basically starting salaries are so low, we can't attract anybody for that position at all. So this is to bring both of them up to a 60,000 base, and we've discussed this concept of raising these issues with centers, and that's well within their starting salary range. So I think we're going to hopefully get this approved, that we can get this, we can attract. Right now, we're spending the money anyway on agency. We're spending well above this for agency. The in-service increase, we had 1 person leave us and started at around 75 for that. We didn't want to go to that limit, but this will give us at least in a competitive range. And the MDS person is basically linked with that position. They're on the same level as far as salary, so we want to bring her along. The MDS person is the one who makes the money for Westmount. She's the one who does all the MDSs, and she's done an excellent job for us, getting her case mixed up and that type of stuff. So that's basically it. We're talking basically 4 positions. They're all RN, they're all the senior management people in the nursing department.
Okay, someone like to move that? Ron, seconded by Dennis. Any discussion? Paul?
Mr. Chairman and Lloyd, I know you're familiar with this, that 1 salary for the nurse manager 2, and I heard you refer to it as a base, but we should really put in the record that nurse 2 position is really being proposed to go to 62,424. And the reason for that is because she has a little bit of longevity with the facility, and you want to have some differentiation between the starting point of 60,000. So that seemed to be a fair equation. The other item that you did not mention, Lloyd, which I think we should clear up today, though, too, since everything is on schedule, and that is the nurse that is becoming the DON. The proposal is for that nurse to be at that DON salary that's currently being paid right now. Is that correct?
Correct.
So, Mr. Chairman, if we may, I would recommend that that be part of this approval process, just so that we have documentation on our records that this committee, as well as the board, approve these particular salaries.
Okay, Ron, it's okay to change that resolution? And Dennis, you okay with it? All right. Any other questions? All in favor?
Aye.
Opposed? Carried. Item number 3, these are county administrator discussions. Paul, you wanna take care of this?
Yes. Actually, on the PBA collective bargaining negotiations, I believe Larry Pelchowitz is gonna be here for that. I don't see him yet, Mr. Chairman, so, on that one. And also, there's tied with the union, that one, Martin and Larry actually both worked on the other union approvals necessary for the nurses that we just spoke of.
Right.
And that one, I don't think we have to go into an executive session. I can tell you that the union has indicated that that could be part of the impact negotiation settlement that we had reached with them concerning all union folks over at the facility. So, but we will need on that one, a board approval, because the board would have to sign off on that particular agreement, just like you signed off on the impact, negotiation. So that would be the final step on the union approval for those 2 nurses' salaries. So I would recommend on that one, a motion, Mr. Chairman, to approve that, if the committee's in agreement.
Okay. Maybe, Dennis? Second by Dan. Any questions? All in favor?
Aye.
Opposed? Carried.
And 3A, yeah,
Patient accruals.
this is, what had happened is under the agreement, when we negotiated the original collective bargaining agreement, we came up with a process of accruing vacation. This is for the new folks that came in. They accrue it every pay period. And it was 3 hours every pay period, but they would also pick up an extra day every 6 months. The problem is that when HR was working on trying to get all of this in, they were finding that this weird way that we did this, if you will, resulted in them having to do manual entries. So what they've asked is, and we also checked with the union to see if they were in agreement, can we, instead of doing this 3 hours a pay period and then manually adjusting it once every 6 months for everybody, can we just simply give them, I think it comes out like 3.08 or whatever it is per hour, or hours per every 2 weeks of vacation time, give them a fraction. I know it doesn't make a lot of sense because you can't take a 0.08, but by the time they earn it, it would come out roughly the same. So that way, it can all be done automatically through the computer system rather than having somebody go back in and manually enter it. So it's the same amount of vacation time, but it's technically being accrued a little faster through this fractional method of award every 2 weeks, rather than just doing 3 hours and then manually going in and entering a day after, I think it's 6 months. So if we can, that's what we'd like to do, is just change it for purposes of automation.
Okay, moved by Dan, second by Ron. Any further discussion? All in favor? Aye. Opposed? Carried. The next item, vacancies filled, that's just for information only. Anyone have any questions or comments on them? All right, so here we are without Larry.
Just waiting on Larry.
Yeah, we're running much faster, I think,
Well, you said you thought it would.
Just to let you know, Mr. Chairman, that I know that Martin did contact Larry and spoke with him yesterday regarding being here, so I believe that he's planning on being here.
We're gonna do take a short break or?
If if you would like.
Yeah. Why don't we take a little break and see if we can raise Larry?
I'll go downstairs and call him, okay?
I never dreamed.
Tavern, have some cocktails.
Now you're talking. I'll get the bus.
I don't know if you noticed, but I went to the
Adjourn this meeting and, go to finance. We'll refer this matter to finance. Hopefully Larry will show up during that meeting. So I need, a motion to adjourn. Dan, Bill, all in favor? Opposed, carried.
Mr. made the motion.